Okay, so dear friends, welcome to Hormonal Physiology of Birth Part 2. I also recognize that in the previous video, my head was blocking half of the screen, and I apologize for that. So I will want to share a little bit more in depth of what was in the first part of this video. And as usual, we're going to take a moment to arrive first. So please establish yourself in the present moment and allow ourselves to come back to the breathing in and the breathing out. Feel your belly expand as you breathe in. And feel your shoulders soften as you breathe out. We will practice like this for the next 3 minutes. Breathing in, I know this is my in breath. Breathing out, I know this is my out breath. In, out. Following my breath from the beginning to the end, I breathe in. Following my breath from the beginning to the end, I breathe out. Following in breath, following out breath. Aware of my whole body, I breathe in, relaxing my whole body as I breathe out. Relaxing body. Body is at ease. Breathing in, I know this is my in breath. Breathing out, I know this is my out breath. In and out. In and out. Thank you for breathing together. And today is the date of 5th May. We are in the year 2026, recording this from our studio, as you can see from the background. So, as I mentioned, we always begin with breathing to allow our body to soften and our mind to quieten down so as to be able to receive the information for ourselves in a way that can be helpful and nourishing. Research has definitely shown that perinatal mood fluctuations is very common because there is a biological, social, emotional, mental, relational change happening in the body in this thing called matrescence. Matrescence means the becoming of a mother. It's a bit like adolescence, which is the becoming of a teenager, or menopause, becoming of what we call crone, which is like grandmother figure. And grandmother figure doesn't mean that we have grandchildren. It just means that we have that wisdom inside us. Okay, so today we introduce the word as well, matrescence. But the intention of this video is to share about or a continuation of the previous one, which was about hormonal physiology of birth, where I now share a little bit more about how birth, a vaginal birth, would unfold in an unmedicated situation. So in the last episode, this is what was presented on the screen, and I would like to continue from there. So today we are going to deep dive a little bit more about the first stage of labor, which most people think is the most mysterious stage, where is the dilation of the cervix. In the last episode, we talked about the early labor, where the psyche of the mother is this a contraction? And then we don't actually know if it's a contraction. We feel some cramps, and that's about it. When we are in active labor, we know the mother is holding onto a chair, holding onto a pillar, or she's suddenly like bending forward, actively coping and breathing, and she is in this is a contraction. Yep. And then when she is in transition, there will be moments where she will feel fear, self-doubt. She would not be knowing when's the end going to come. Then that's where she have this thing called the freak out zone. And the psyche would be just keep going. So first thing first, we talked about the dilation of the cervix in early labor is 0 to 4 centimeters. Contractions happen 5 to 20 minutes apart. And then when it is active labor, the cervix dilates about 4 to 7 centimeters. Contractions are 2 to 5 minutes apart. The thing about recognizing this duration is by the time you reach transition, you will notice that there is actually no indication of how far apart the contractions are, because the contractions are happening quite quickly. So that's why we would just indicate it as a pressure in the rectum, and she will be feeling the urge to be pressing, bearing down, and there is no indication because the contractions are like just boom, boom, boom. In the last episode, we also mentioned that in terms of labor and in terms of the words that she speaks, as labor progresses, the number of words that she speaks will also decrease as well. So this is something that is to be worth noting for, because when she's in transition, there will be minimal words being exchanged. Contraction, duration. So in early labor, very similarly, you can see that it's a blank here. There is no indication because in early labor, we don't even know if she is having a contraction. She is not actively coping. So many people tend to go to the hospital too early when they're in early labor, and that's where the cascade of events may happen once we set into the system. Fortunately, we are in a very safe system. Unfortunately, the time starts ticking. So we want to establish that we do not go into the hospital too early, neither do we want to go to the hospital too late. So going back to having that communication with your healthcare provider, it begins now. As I was saying, in early labor, there is no indication of the duration of contraction, but in active labor, when she is actively breathing and coping with it, research has shown that contraction lasts about 60 to 120 seconds. So if you have practiced what we did just now, that was about 2.5, almost 3 minutes, probably about 3 to 4 contractions already. So then it is such a beautiful reminder that our breath, if we can lengthen the breathing to go through the contraction, it can pass. If a breath is inhale for 4 counts, exhale for 6 counts, that takes about 8 to 10 seconds. So possibly about 6 breaths for a contraction, and then you rest. Rest, again, another 10 breaths or 6 breaths. The next wave comes in 2 or 5 minutes, and then you rest again. I cannot emphasize enough how important it is for the break in between the contraction to do nothing, to drink water, and to just change to a sideline position or flip to another side or come into a dynamic position, whichever that your body is calling out to. In my first labor, I tried to do many things because I had so many information as a yoga teacher, as a childbirth educator. I gave myself a lot of pressure to change position, take the birthing ball, go to the toilet, and I found that my legs just wanted to give way, even though I did a lot of squats in my pregnancy, but during labor itself. In my first labor, I was doing a lot. Subsequently, in my second and my third labor, I recognized that all I want to do is to lie down on my side in a side lying position with one leg higher than the other. We practiced this in class before as well. So please check in with yourself. If you're tired, stay on the bed. Use your ounce of energies to cope with the contraction instead of trying to become dynamic, trying to go on the birth stool, trying to go on the gym ball. Honestly, the reason why I never ever teach using a birthing ball in our birth workshop is that if you are not used to being on a birth ball, you most likely won't use it during your labor because you're already going through it. And one last thing to be on your mind is how to balance and not fall off the ball. So to some people who use it every day, is part of what their daily routine is, birth ball makes sense. But for the general majority of the public, doing a side lying position may be good enough. Use your energy for your breathing, for your holding onto the bed rail, for your crying, shouting, for your drinking water. That's how we would go. I digressed again. Coming back to active labor, so it lasts between 60 to 120 seconds. And then when we go into transition, you can see the contractions are much shorter. So life is very fair. Mother Nature is also quite fair. Yeah. When your contractions are stronger, they are also shorter. I repeat again, when your contractions are stronger, they will also be shorter. So it will feel like a marathon to a sprint. Okay? And then we will move on to the next part. If you see, I have also indicated at the bottom, there is this part where we mention severe backache, feel the urge to bear down. On top, there's also membranes back rupturing. So I wanted to highlight these key points. These are like the wild cards of labor that people don't really talk about often. So when will water bag rupture? We always assume that when water bag rupture, like the Hollywood movies, oh, everything panic, attack, but actually there is still some time. Asking your healthcare provider how long you have. Maybe it's 12 hours, maybe it's 10 hours, as long as you remember what we shared earlier before, checking in with COAT, color of the water, any odor, what is the amount. If you're not sure of this, please watch the previous video. Temperature of the mother and time that it happened. Okay, so it is also possible that the water bag only rupture at the birth of the baby. It's perfectly normal. Rupturing the water bag is actually a way of augmenting, which means to speed up labor. So you don't have to rupture your water bag because can you imagine this water bag is your baby's home. It has the amniotic fluid, which is the baby's food. So when water bag is ruptured, as of any animal, any surviving living being, when your home is being disturbed, of course, there is a need to come out. So yeah, water bag rupturing may happen before labor, active labor. It can happen at the birth of the baby. Okay. Severe backache, again, is a wild card here. So it can happen in early labor. Maybe it's not too intense. It could happen in active labor. It could also happen in transition labor, though most people recognize it is more prominent in transition because the baby has descended down. If you have seen the first video on physiology of birth, physical physiology of birth, you will notice that the baby's spine is pressing against the mommy's spine, which is why I propose to be in a side lying position just now, like 2 or 3 minutes ago, so that the mom can go into that extension to arch and lift the tailbone slightly for baby to descend down the bottom of the pelvis. So then that's why there's a backache. When we have an unmedicated birth, every pain that the mother is feeling is a message for her to change position, lean to one side, to bow forward, to curl up, to make a growl so that her upper abdominals contract and then can pull up the birth canal to expand below. So pain is a messenger for people who choose to attempt an unmedicated birth. It's our friend, okay? And then that's why I wrote here as well. We want to lean into the pain. What we can say is using the pain, you go like baby, breathing in, and as you breathe out, the pain starts like baby. So it's that E sound, and you can say ow. So you have to realize that words have power. So if you believe that words have power, you can use this to support yourself to go through the peaks of labor. Okay? All right. So now this is the first stage of labor. Now let's talk about the second stage of labor. Again, if you missed out on what are the stages of labor, please look at the previous episode, okay? So second stage of labor is what we call the birth of the baby, and it takes between 20 minutes to 3 hours. So generally it's 20 minutes to 2 hours, but if someone is taking epidural, then it becomes 3 hours because there's additional fluid, there's chemical exchange in the body, etc., etc. Okay, so then the birth of the baby, when the baby is out, baby can come onto the mother right away, and that's where skin to skin can be established. If baby is unwell and have to go to NICU, then we will have to follow the protocol of the hospital. Though we can also ask if one of the parent can go with the baby. That can be quite supportive and reassuring too. And then otherwise, in a regular situation, we would have the baby onto the mom for skin to skin, which is why in the previous episode, we said that you have the choice to take off your undergarments so that you have one less thing to worry about. We already mentioned that when the mother is giving birth, her senses are heightened, her skin is more sensitive, her nose is so much more sensitive. She can pick out lights and smell and sound. So basically your five senses. The skin to skin is a way to release more oxytocin inside her so that it can kind of like bring her down a little bit after the transition state. So also in transition state, it is very common for mothers to be trembling, to be shaking, because it's just like when we go into a cold room and then we have to just shake off our feathers. So it will happen like that as well, allowing yourself the possibility that you may behave a little bit differently than normal because, girl, you are giving birth like a volcano erupting, okay? Earthquakes happen and you have a body, you are bringing life into all of that's a big thing. I think it's a superpower. If everything is flowing, what happens after skin to skin is you will be allowed to offer your first latch. You can have baby on your breast and then you can have your first latch. Usually the nurses will be there to help you. But if not, this is a perfect chance to also watch our other episode on breastfeeding, where we also shared some of the positions and what to look out for. When we talk about breastfeeding, we are looking for the deepness of the latch. Make use of the resources in the hospital as much as you can. All right, what else? Something's missing, right? So then baby's out on your breast. So what next? We move on to the third stage of labor. Welcome to the third stage of labor. So we will think that, oh, after the baby's out, all's done. So then, hello, we have one more, which is the birth of the placenta. So after you push your baby out, you still have to push your placenta out. When you push your placenta out, of course, it's a much softer organ than your baby's skull. So it will still have a contraction and probably the effort to pushing it's a little bit less. I wouldn't say more or less, but maybe just slightly lesser than maybe. So yes, when you want to birth the placenta, it takes about 10 minutes. I also want to point out here that if you are choosing to take an unmedicated birth, sometimes at this point, the healthcare provider may still offer you something extra. So what is the something extra? It's actually the injection of Syntocin. This is usually applied near the perineum, and they will also inject you with local anesthesia before they start with the stitching. Syntocin is to prevent postpartum hemorrhage, and it's also to support some mothers who may need one more contraction of the uterus to dislodge the placenta. So then what happens next? So after you birth the placenta, the gynae would inject local anesthesia at your perineal area before they go on with the stitching. As they're going on with the stitching, your baby will be in your arms or maybe in your partner's arms. The nurses may come over and offer you a fundal massage. What is a fundal massage? So a fundal massage, fundus. Fundus is the top of the uterus that rests right here, if you can see my video. And then they will press down into the top of your uterus to release this thing called lochia. Lochia, you can think of it like plenty of blood in the body that is used to support the pregnancy. Some people say like it's period blood from 9 months, but I don't really think it's the same thing. Anyway, so you may feel very uncomfortable at the beginning because this part of your body is so protected for the last 9 months, and suddenly someone is pressing into your stomach. It feels radical and out of the world. Once again, I invite you to lean into it as they are pressing down. You can breathe out together with them instead of fighting them. You can and use your F breath, S breath, horse lips breath. These are all ways of breathing. Or you can just simply tell them, hey, can you please be gentle with me? I'm going through a really uncomfortable time right now. Sometimes they agree, sometimes they don't. It is dependent on the healthcare provider. They are there to do their job. So we can just try our best to share our preferences and let them know how they can support us to help them do their job better. Cutting of the cord will happen, so that also depends on your birth preference. Is it delayed cord clamping or immediate cord clamping? Are you going to wait until the cord completely stop pulsating, turn white, or do you have other arrangements like cord blood banking? This is where your birth preference will come into place, and again, all this presents an opportunity to speak to your gynae right now in your prenatal visits and not after, during. Who's cutting the cord? Is it the gynae cutting the cord? Is it your partner cutting the cord? Is it someone else who's attending your birth cutting the cord? In Singapore, people don't really practice this thing called lotus birth. Lotus birth means that they bring the placenta home together with the baby, so the cord is not being cut. The placenta opens out really big like a lotus leaf, and then in some tradition, in some cultures, they would choose to bury the placenta in their home garden or turn them into placenta capsules to be eaten up because it's maybe has some healing benefits. So the science is still ongoing for that one, but that's what's happening. You can choose how your placenta is being taken care of. Most of the time, if we don't have a preference, they would be chucked away with the bin. But if you want to, you can choose to have a look at your placenta first. You can make that sharing before. But if that is, some couples are hemophobic, they don't like to see blood, then maybe we can scrap that off the birth preference list. Afterwards, you will notice that when the placenta is dislodged, immediately there is a hormonal recalibration. And when hormonal recalibration happens, it simply stands for your body is going to go through from pregnancy mode to recovery mode, recovery plus breastfeeding mode. So your body's going to start to have this hormone called prolactin to produce breast milk, and a lot other of hormone recalibration happening here. After pains and soreness is also going to be felt here, just like you have finished running a marathon. So this is something that you can foresee will be happening in the third stage of labor as well. And we are on the last stage of labor, which is recovery and bonding. So in most tradition, we will start this fourth stage right when the baby is out. So sometimes that's within the delivery suite itself, or it can be back into the room. In the fourth stage of labor, we talk about the washing of the baby and the weighing of the baby. People may assume that they happen at the second stage, which is the birth of the baby, but there's actually no rush. So we have also established that when baby first come from the womb into the world, sometimes they may have certain substance on them. That's what we call the vernix. So the vernix looks like cheese on their skin. It's actually their own moisturizer when they're in the amniotic fluid. So swimming inside the water bag, inside your womb. So then for some traditions and cultures as well, they prefer that the first touch of the baby coming from womb to world is the mother's skin to skin, which is why skin to skin first before we wash or wipe the baby. However, like I mentioned just now, there are some parents who are hemophobic and they may not be comfortable with the baby with vernix or blood, so they prefer to have the healthcare provider to give the baby a dry wipe down first before being presented to the mother or the parent. If you prefer your baby to have skin to skin first, you can make that known in your birth preference. For some of us, we do recognize that as babies, their skin is very soft, and sometimes when healthcare provider receive them, it is quite a rough texture of the towels, dry towel especially, against their skin. So again, this is something for you to contemplate, ponder about, and discover where is your preference. Weighing of the baby can take place on the day itself or 1 or 2 days after. They usually will monitor the baby's weight before they discharge us. Umbilical cord naturally will drop off within a week or so. In 2019, the protocol for umbilical cord care is using alcohol wipes. But in 2022, this sharing from my own experience is the protocol has changed to be using sterile water, which is like any boiled water, because I think Singapore water is generally quite clean. So recognizing that protocols can change, and you can check in and ask what is the latest or most natural, most holistic way of how you want to support the baby's arrival into the world. With hormonal recalibration, very naturally, and I think it's such a hot topic recently, we talk about baby blues. So baby blues happen to 80% of women giving birth because of this big dip or big change in hormones as her body switches into recovery and breastfeeding mode. So in these first 2 weeks, you'll be crying for no reason and you may feel intense emotions, and putting it out here first that we want to recognize that your feelings are valid instead of trying to press them down. It's like trying to press a ball into water. It will only bounce back up again. So that's where the breathing in and the breathing out comes back into play again. Everything that we have been sharing from the start of the video in every episode, using our breath and anchoring ourselves back in this moment, recognizing where your feet is, your hands are. It sounds silly and simple, but it really is that simple. Coming back to the breathing until your breath is, easeful again, and you recognize that feelings are really just like clouds. They come and they go. Okay, so there we have it. We have the 4 stages of labor. Dun, dun. And this is essentially what it's like as you step into postpartum. It's a brand new journey, but just want to say that you are not alone. As you are going through your stages of labor, there will be a point of time where you have this feeling that you won't make it through, and it actually just means that you're getting closer to the baby. I wrote this here as well. There's usually this thing called the one forbidden thing, where you will be doing something really uncomfortable. It may be giving up, asking for help, surrendering, trusting, becoming not you because of how we have been early conditioned. So when you are being tested to do that one forbidden thing, this usually means that you're getting closer to meeting your baby. Last but not least, this is a summary. You can screenshot this and share with your partner, your relatives, whoever is going through birth. I categorize it into early, active, and transition because this is something that most pregnant persons want to know about in terms of physical what can be expected in terms of emotional, what can be expected, and last but not least, in terms of partner, what is their role. So, for example, in early labor, if you are having mild cramps, you're having a little bit of a backache, you're in your final nesting mode, there's some excitement. Oh, is baby going to come? Is it today? Is it tomorrow? You're very chatty. And then what the partner can do is to protect rest, not to rush decisions. And I wrote here to bake a cake because, you know, when you want to bake a cake, you have to go and buy the ingredients. You have to let the cake sit. You have to wait for the oven to be preheated. So you actually want to give yourself that amount of time. Active labor, physically, she will be having stronger waves. She will be turning inwards a lot to her breathing and her coping. She may be irritable, less chatty. She will start to be triggered by every small little thing, but just for partner, please don't take it personally. You can just be a caveman vibe, you know, like the caveman protecting the cave when she's in her birthing cave. Transition intensity will peak, senses will be heightened. You will see a strong surge in adrenaline because, like we mentioned, at the point of the birth, she has to ensure that the environment is safe. So she will also be saying things like, I can't do this, I want to quit, I'm very scared. So that's where your one forbidden thing comes out again. Asking her to do something differently when it goes beyond what she can imagine. Sounds radical, sounds scary, but remember that the contractions are you, they are not outside of you. So everything is within, but from within. Last but not least, as a partner, you can name what's happening. My love, you are so brave. I love you. Thank you for being here, for birthing our baby. You don't have to try to fix anything because if you're trying to fix her, she will feel like there's something wrong with her. So then, when in fact there's nothing wrong to fix, all you have to do is offer your eye contact, words of affirmation, watch the previous video if you missed that out, and grounded touch. Grounded touch means supportive, like a mountain, solid, instead of like buttery fingers and like itchy fingers. So go and experiment what grounded touch feels like right now. We don't wait until the labor happens. We can start right now. So yes, that's all we have for today. And I hope that this episode is helpful. We'll close the session with 3 deep breaths. Establish yourself in your sitting. Feel the feet on the ground. Let your shoulders down. Let your spine be straight. Breathing in to your belly for 4 counts. And breathing out from your belly for 6 counts. Breathing in. Breathing out. Thank you for practicing with us and take this time to contemplate, integrate whatever you have heard. We are here for you. You can reach out to us via email, via Instagram, or we are just a text away via WhatsApp. See you next time. All the best.